So welcome to everyone here. Seems like I think we have a lot of new members to DSA, so welcome. This might be one of your first events that wasn't a GM, so hopefully it will be a little more inviting than that can be. And thanks to people from other chapters who are here too, and to people who have done this a few times but want to learn some of the new stuff that we've incorporated into this training, especially from some of the people on our committee who work in unions and have helped broaden our tactics. So why are we doing this training? One thing you might have noticed is there was like a minor shift in power yesterday. And we want to kind of, one thing that's really nice about what the turnout shows and how many people have come to this and how many new members have joined Philly is it gives us a sense that like no one's checking out. No one thinks that we're done. And a lot of the sense in Philly DSA is that, you know, this is the time that we can actually push for things that we really believe in and maybe effectively. And so with the new administration and shifts in power locally too, we're really excited about the idea of hopefully in a way that really reflects our values, organizing both nationally and locally. So that is one thing. And also, as we can see, there's an urgency for encouraging people who are disillusioned and feel that everything's corrupt to join something that's hopeful as opposed to something that's destructive. And when people join things that are destructive, it tends to be a little too late to encourage them to shift. And so organizing really hard at this moment when people are trying to figure out what camp they're going to go in and finding people who really feel that things need to operate differently and showing them that there's a humane and loving way to do that is part of our goal too. So it's an urgent task, especially I think in the next 2 years, showing people that there's a different way, maybe 4. So what we are doing, that is why we are doing this, and what we are doing is going over how to have organizing conversations. This is with family, friends, and coworkers mainly. We're focused in particular on 2 issues that Philly DSA has endorsed, which is focusing on healthcare for all and also anti-austerity, which means making sure that governments actually have money so that they can give things to people who need them. So those are the 2 things, but these conversational tactics can be wielded for anything. They can be wielded for nefarious purposes. Hopefully they'll be wielded for building solidarity, but like if you have your own agenda, it will help you too, for better or for worse. So that is the nature of what we're trying to do. Canvassing, the committee that's putting this on, we're the canvassing committee, and we have mainly done door knocking for obvious reasons. We can't do that right now. And so the people that we're mainly interacting with are some strangers, but for the most part, friends, family, coworkers. And I think that this can feel like, oh, we don't have an opportunity to organize, but I actually think there's a benefit here. Organizing is stronger always if people are in networks. It'll always be stronger if people are connected to other people. And there's also like a shift in, I think a lot of us became political in 2016 with Bernie. And now there's a shift into thinking of ourselves as socialists or people committed to putting people over profits as a lifelong mission that, you know, we incorporate into our lives rather than we're just going to get Bernie elected and hopefully that happens. And so I think you all being here really shows like a commitment to the longevity of this project and the desire to leave the world a little better than, you know, we came into it, and that being the aspiration. So I think that this shift can be seen as kind of a bummer, but I think there's also an opportunity here now that we're talking more to the people that we love and are in our lives. So what I want to do to kind of illustrate how, and I'm going to ask for a few examples, short examples, but of the same, is like what kind of conversations might be coming up in your life that would be organizing conversations. I'm not going to use names. I hope I don't forget that. And if people volunteer stories, please don't. In here or the breakout rooms, obviously give anyone's name unless it's your own name, and then say whatever you want to about yourself. So one example is that I have a friend who's a nurse in New York City. She's a labor and delivery nurse. She's ununionized. She really likes her salary. Her partner got COVID and they didn't have any extra COVID days off, so she was encouraged to come in. So there's been some dynamic she didn't like. But when the vaccine rolled out, all of the doctors and administrators got the vaccines before the nurses, even though the nurses are the ones who by far have the most contact with the patients, many of whom, not all of whom because it's labor and delivery, but many of whom did have coronavirus. And it really upset the nursing staff for good reason. So this is something where me, who does organizing, thinks a lot about the fact that what would a union make in this difference? How would maybe healthcare, different arrangement of healthcare have changed this? As people who are going to talk more about tactics as we go are going to show, jumping into just like, well, why don't you form a union might not be the most supportive or helpful thing. And we're going to talk about like how to have a conversation to push things in a direction of building solidarity when you hear about stories from people that you love that clearly have political undertones and are something you would want to use to build solidarity. So another example is that unfortunately, one of my friend's cousins passed away from an overdose this week. And when that happened, she was talking to her mom, and her mom said, well, it was inevitable. And my friend's reaction, she's a social worker, was not inevitable. With a different structure, with different counseling for addiction, with different resources, it absolutely wouldn't be inevitable. And maybe saying to her mom that in that moment could have been helpful, maybe not, but figuring out how she could have maybe gotten her mom to see suicide or overdose or these issues as something that's a collective problem of our society that we have to work together to rectify rather than inevitable things that happen to some people, would have been a form of an organizing conversation. So obviously these types of conversations, they have times and places to some extent. And I think that people can think of organizing conversations as opportunistic, like you're taking advantage of someone's pain or someone's suffering to push some agenda. And I want to push back on that conception and encourage people to think about organizing conversations as a form of support and kindness. Again, like if someone's falling apart, you might not want to be like, form a union, but there are times when you can say like, I've been listening to what you've been talking about and I wanted to talk about some things that I've been working on or know people who are working on that I think could change this for us. And what we're going to get into with these conversations, some of the reasons I think they show support is one, you have to be an extremely good listener to do an organizing conversation. You have to understand what someone's issue is, why they have that issue, and what kind of things they're looking to change. You have to tell people that they're not alone. That's part of building solidarity, which is a helpful thing to hear if you're upset and having a hard time. You also are trying to encourage people to find hope and see a way forward to make things better. And finally, and maybe most importantly, you're telling someone that you care about that you're going to fight with them and for them and alongside them to make things different. So a lot of this is going to be more technical in some ways, but we will continue to kind of tell stories of how we think these conversations come in. But part of it is thinking of this as a project of genuine kindness and help, and hopefully a lifelong project of transitioning people. And so we figured since there's a lot of new members, especially, this would be a good intro to the world of organizing. So really quick, because we want to move on to other stuff, but still I'd like to hear. I can't see people because I'm recording really, so if someone else wants to call on folks, but if anyone has an example of like something in their life during COVID or elsewhere where they feel like there's been an opportunity for an organizing conversation, we would love to hear. You can use like the raise your hand in the chat function too, if it's there. Any examples? It's okay if not. We'll also have time to talk in the breakout rooms. And thank you, Mindy, for saying don't be shy. All right, well, people are welcome to be shy. Maybe we'll talk a little bit more in the breakout rooms about this stuff too. I'm sorry if I missed anyone because it is hard for me to see. But what's gonna happen for the next hour and 15 minutes is that we're gonna go through key points and tactics of an organizing conversation. In the breakout rooms, maybe Mindy's advice will come through and people won't be shy, and you'll get to know each other a little bit more, and Philly DSA people also can get to know each other. And And then please stick around after that just for talking about next steps. So I don't remember who I'm turning it over to, but I'm turning it over to you, and hopefully you remember who you are. And thank you guys for coming.
It's me. Thank you, Hadass. Hi, everyone. My name is Liv. I use she, her pronouns, and I've been on the canvassing committee for a couple of years. I'm also on the steering committee of Philly DSA, and I'm going to start us out at the top of an organizing conversation, or at least when you think about it with a really rigid structure. Actually, I'm going to set a timer first of all, though, so I don't take more than I'm allotted. So I'm going to start us out at the top of what we think of a structure of an organizing conversation is, which has to do with finding the issue of the person that you're talking to and drawing out the issue. And as Hadass said, being a good listener, being kind and thoughtful and open to the other person who is hopefully also going to be open. So I want to frame this section as both finding the issue and doing this part for a friend or somebody that you're fairly close to, and also for talking to people that you don't know at all, don't know very well. Because you're going to have, like, there's going to be a little human judgment here about like what kind of questions you can ask somebody. But as Hadass said, lately we haven't been doing door-to-door canvassing, so we want people to be thinking of where these things are coming up in your own day-to-day life, and when you've been thinking like, I wish I could like make this conversation kind of political with this person. So I hope this is gonna be somewhat helpful. So first I want to start out with, like, we talk about this phrase, find the issue. Well, what is an issue? And something that I have come more to understanding is that an issue is not Medicare for all, for instance, or an issue is not pensions being cut unfairly at all, honestly. The issue is I can't sleep because I'm worried about this medical debt that I have that's building up, or I'm upset because my dad is still working in his 70s and he doesn't have a pension. So the issues are like these, often like they're very personal, emotional effects of these disparities that come about because we don't have the proper safety nets, the proper protections as humans in this world. And it comes along with strong emotions. So, I mean, a lot of it is worry, but there's anger, there's sadness. I mean, especially like Hadass said, somebody who lost their life and people around them are dealing with that sadness. And then like there's anxiety for things that are coming up perhaps. So we, as organizers and approaching these types of conversations, you want to try to draw out some of those emotions and get people to go there a little with you. Again, you do have to be like, use your judgment about where you're going and the environment, but these are the kind of things that evoke strong emotions. So what about when you're thinking about like having these conversations with your friends? I would say maybe in the past, like if you're friends, like you've been sympathetic, you've been like, oh, that sucks, that sounds awful, but maybe you felt that it was inappropriate to go deeper. But I would encourage you from time to time to consider like, like could now be a good environment to like make some of those next questions. And what are those questions? So I want to put a pretty simple link handout in the chat, which is from our great resource labor notes, that is pretty simple tips on how to be a good listener. And these are things that you probably like could pick out, but sometimes like it's sometimes nice to just go over them and think about them. And I don't know if it says exactly on there, but I want to bring up now the types of questions that you'd want to be asking people. So I like to think of these questions as what questions and how questions. And to be more clear about that, for example, if I knew somebody, like maybe this was somebody that I knew fairly well, and I knew that like they had talked about a crappy healthcare situation that they were in. So like I know that there's a pretty strong basis here that they would support Medicare for all, socialized healthcare. But the questions that you want to ask on this point is, how is it affecting them? So are they not able to pay their medical bills? Do they worry about that? Do they like avoid checking like their email or something because they're afraid of getting notifications? And then asking, how did it feel? Or how does it feel when you got that bill, that unexpected bill? Or what did you have to put off in order to afford paying for that? So for the example that I gave earlier about somebody who is really anxious because their parent is older and is still having the need to work for wages to take care of themselves, this actually like I was at the grocery store a couple months ago, and the cashier was talking to the person in front of me, and he was saying how much he hates Mayor Kenny, and it was like a lot of like, it was kind of culture war kind of stuff. But at one point he said, yeah, like I just can't stand them. My dad was a firefighter for the city and he lost his pension. And so because he was cashier, like I did not, and he was like, I was the next in line, I didn't like immediately proceed to try to organize this person. But it could be like in another situation where you'd want to like stop and be like, oh wow, like that sounds really hard. What did your dad have to do to like take care of himself as he was getting older, as he is getting older? So asking questions that maybe seem uncomfortable, but going there with them and drawing it out. I have 3 minutes left. Some of these things might be on that little handout, but just to point out maybe somewhat more obvious things, but again, I try to keep these in mind, like when I recognize that I'm going into this kind of conversation. You want to try to let the other person talk more than you're talking at this point when you're like when you're getting them to talk about an issue that they're having. And you also don't want to do super leading, super fishing questions like, so wouldn't you think that a single payer healthcare system would be much better in this country? Like, we're not at that stage when you're drawing out like emotional issues and problems that they've had. So listen more than you talk, and just be like an active listener, nodding and doing like and those sort of verbal cues. I will say when we finally do get to canvassing and phone bank again, which I hope is sooner rather than later, we do like to give people tips on how to talk to somebody who just like is totally stonewalling you. It does happen where somebody is just like, no, I'm good. Like, I don't want to talk about this. I'm not political, that sort of thing. And the tips that we give to people when we're going out door knocking is to try to use the context around. Maybe you just talked to somebody else who said like, my kid goes to this public school, but we're worried about the asbestos. So like you can say, oh, do you have kids? I heard like I was talking to somebody else and they were telling me about this public school. So yeah, context and being willing to push a little, again, with care, like Hadass was saying, with sympathy and like willing to listen and care. So I am going to transition at this point. Say you've like talked to this person, you know how they're feeling about a problem, and you also know like, oh yeah, I'm a socialist. I know like what we need. So here's an example of how the pivot would work to talking about like an actual campaign that maybe you're working on. So let's say I'm talking to this person who is mad that his dad lost the pension. That sounds really hard, like having your dad have to still work in his 70s. It's really difficult and unfair. There's my timer. And that's why I think we should have guaranteed state pensions that can't be gambled away by hedge funds. Then you're going to gauge that person's response and proceed to the next section when we're thinking about it as a structure. So I'm going to pass it off to Sean, and Sean's going to take over.
Thanks, Liv. All right, I'm Sean. I use he, him pronouns. I'm also on the canvassing committee, been active in Philly DSA for the past couple of years. All right, so like Liv said, when we started this conversation, we were talking about an issue that affected someone personally, but by now we've connected that issue to like a more fundamental issue, something that's more like a root cause. And that's an important step because, like the fundamental issue, the root cause is something that's widely felt. It's felt by a lot of people. It's something that's worth organizing around. So, an example of this from my life is I'm talking to a friend of mine who is a city employee, and they were upset that they don't get paid enough and that their pay is frozen this year due to the coronavirus or whatever excuse. Their crummy pay obviously affects them quite a bit, but it's not an issue that's deeply felt. That's their issue. I'm sure other people are very, including me, are very sympathetic about it, but it's very much compartmentalized. So in that regard, it's an issue that's not worth organizing around. However, through talking to this person, it was possible to connect their issue to a couple of larger, more deeply felt issues. So one issue is that the city claims to be barely able to afford to pay any of its employees what they're worth, even though it could if it just prioritized paying workers fairly. Also, the city's capitalizing on this crisis by slashing budgets, which ultimately benefits the rich, rather than pumping revenue into the city like it should be. So now we've identified a problem or a couple problems that are deeply felt by almost all city workers. And this is all under the umbrella of austerity in the city's budget, right? So from here, I want to inspire my friend to organize around this, to take the next step towards action. And I'm going to do this by relying on my two friends, Agitation and Inoculation. Okay, so agitation is what it sounds like. My friend has a right to be angry. They put a lot into this job, and they don't deserve to get paid a pittance for what they do. And I want them to know that those feelings are valid and that they're common too. I want to also explain that other people in their position are also upset about them. Also upset about the same thing. And so just like previously, when I wanted to avoid telling my friend what their issue is, I wanted to instead draw it out through conversation. I don't want to tell my friend how they should feel about this. I'll let them tell me. And if they aren't already telling me, then I can always rely on my one trusty tool, which is the painfully obvious question. So examples can be, one, how does it make you feel that the city pretends that funds don't exist to pay you and your coworkers? Two, is this something you think about when you're not at work? Three, does this affect your personal life? I should also get my friend to start thinking about who's truly responsible for this, because this will or should lead to a good discussion about who we can start taking action against and who we can organize against. So, questions that I can ask include, who do you see as responsible for freezing your pay? If they respond that, well, my boss isn't doing anything when I talk to them about it, I could respond, well, it's very possible that this is an issue with your boss, but it could also be that your boss doesn't have enough in their budget to pay everyone more, and that this issue is at a higher level in the city's budget. Do you think that city council, which determines which determines the budget for your department, could generate more revenue to pay all of the city offices more if they looked into more sources of funding, if they did more. Don't you think that the cost of living is going to keep rising while your pay stays the same? I obviously don't want to needle my friend and make them feel horrible or feel despair for their situation, but I do want to sort of stoke this sense of indignation and get them to see that there is an enemy here, and it's an enemy that's common with all the people that are in this similar situation. So I could ask questions like, who do you think benefits from your pay being frozen? Do you think it's fair that, for example, the real estate developers in the city get to continue living under a real estate tax abatement? Well, we all effectively get poorer. Will our pay remain stagnant and the cost of living goes up? It may also help at this point to be more specific about the issue. So, I can, if I know about them, I can talk about revenue options that are available to the city, like fully ending the real estate tax abatement that I keep talking about. I can talk about low interest borrowing from the Federal Reserve. I can talk about all the different other types of taxes that there are available to raise and maintain. I could also bring up the United States Congress and our new president and their plans, or lack thereof, to issue further stimulus money, both directly to us and to the city. So either way, hopefully by now my friend is starting to get interested in getting involved somehow. Like they're starting to feel the itch to move to action. And, this is a friendly conversation, but it might make sense to start brainstorming some things that they can do. Or maybe even there is like a DSA event coming up. Maybe we're doing something virtually around austerity and it makes sense for them to come and, and continue the process from there. So from this point, we can move on to inoculation. Okay, so inoculation is also what it sounds like, just like how rich people get vaccinated against COVID, my friend needs to be vaccinated against the counterattack they'll see when they join the fight against austerity. So again, we can ask some open-ended questions that get them thinking and put them in the mindset of being in this fight so that they're not taken off guard once that they're actually in this fight and they experience these things. This will help keep them from getting demoralized later, and also help get them just generally interested in this process. So, some things that you might ask, if you were the mayor or you were city council, how would you react if a bunch of Philadelphians or a bunch of municipal employees in Philadelphia showed up at your doorstep demanding an increase to their share of the city budget? Would there be any ways that you would appease them without actually changing anything, like any sleight of hand? Do you think it's acceptable, for example, or do you think it would be acceptable if they didn't end the tax abatement all at once, but instead made some sort of like gradual transition as a compromise, which they've already done? How would you feel if they did some other type of half-hearted compromise like that, but then went out to the press and claimed that both sides of this disagreement had reached an agreement? What would we do in that case? Agitation and inoculation, you can sort of start to see that these things go hand in hand, where agitation is solidifying the issue and finding a common enemy. Inoculation is laying out the lengths that this enemy will go to maintain the status quo, to maintain their power, their wealth, whatever. So naturally, inoculation has the effect of like further agitating someone, just by laying out all the ways that the adversary will be adversarial. So for example, a city councilor may publicly insinuate that my friend's office is being greedy by asking for more pay, claiming, we're all in this together, so that it's divisive to ask to be paid what you're worth. And, hearing something like that is infuriating, which helps with agitation. But it's also useful for us to consider how we'd react, which helps with inoculation. Okay, so from this point, the conversation should flow into concrete action. If we were canvassing, then we would have something like an ask. I need you to get on the phone with Mayor Kenny and tell him to not veto the budget and some change to the budget or something like that. If you're just talking to a friend, this is a good point where you can start to brainstorm concrete actions that they that they can take. It's also always important to have a plan to follow up, right? So, an example could be my DSA chapter is having a strategy meeting about these sorts of things on Sunday. Will I see you there? Or, I'm going to reach out to you next week and ask you about how the initial meeting with your coworkers went. Okay, so that's agitation and inoculation in a nutshell. And what this is it's sort of a rough blueprint, sort of like a plan. And like any plan, you shouldn't expect to stick to it strictly. And you just need to be ready to roll with the punches. And this leads to our next segment, where I'm going to turn things over to Tyler, who's going to talk about some common obstacles that you'll face and some tried and true methods for dealing with it.
Thanks, Sean. Hey, everyone. My name is Tyler. I use he, him pronouns. I've been organizing with Philly DSA Canvassing Committee for a few years, pretty much ever since my house in Fishtown at the time got canvassed and they left behind cool Medicare for All pamphlets and stuff. And canvassing for Medicare for All and then subsequently for Bernie's political campaign has really been some of the most rewarding experience that I've gotten to have. I think, just talking to people about the fact that political change is possible and sort of opening eyes to the sort of, moral rot of the society that we live in that treats people horribly is really, honestly, there's like nothing better. It's great. So I'm really excited to share some techniques with you guys that I think have made me a much better organizer and much better at having these conversations. And first, what I want to talk about is the fact that a lot of times when we have these conversations, people feel like they're supposed to be in a debate. I think both we feel like that as speakers or organizers, and people whose doors we knock on or phones we call feel that way too. They feel like they're supposed to make arguments, and that can confuse us, because what's really happening a lot of the time is people are expressing an emotion and giving you a chance to see that they're upset in some way. And a lot of this has to do, I think, with the information landscape that we live in and the fact that we're pretty heavily conditioned to believe that things can't get better, that things are the way that they're supposed to be, and that we shouldn't try to change it. And so I want to share a document with you that I'm going to post in the chat, and I hope everyone who's able to look at it and still listen will open that document. And that's called Responding to Disorganizing Emotions. And if you open that, you're going to see kind of a few different examples of disorganizing emotions that we can all experience. The ones that we have here, and of course it's not limited to these, but we have hopelessness, the idea that things can't change, that we have no power. We have division listed here, so pitting people into smaller and smaller groups, making us not realize what we have in common. Confusion, which is like promotion of messages that alarm and distract us. And disengagement, just a general lack of interest, not even caring whether things are possible, just, I have to take care of myself, maybe I have to take care of my family, but like, I just can't think about politics. I can't think about organizing. I can't think about trying to make the workplace better. And so there are a lot of different examples of things that people will say that are really kind of just letting you see these underlying disorganizing emotions. So an example that we have listed here is, won't universal healthcare be too expensive for our country? And like, you can just look at other countries, it doesn't make sense. And so it, in principle, doesn't like really deserve to be dealt with that much. However, it's something that we're constantly being barraged with, that we can't insure everyone, that we can't provide healthcare to everyone. And so when we talk to somebody who believes this, we have to kind of treat the underlying confusion and help them see that that's not the case. So we like to use a technique which basically is like a simple format for answering questions and responding to these kinds of disorganizing emotions. So that format is called Affirm. answer, and redirect. When someone raises a concern, the first thing that we want to do is show them we're listening. And so we look for something within what they're saying that we can affirm. Then we want to actually, take the person's concern seriously. And that's something we can do by answering the concern. Hopefully we're answering it with our own personal experience, but if it's relevant or important to bring in some kind of like factoid that you have stored in your brain, that's fine too. And then we want to kind of try to redirect. And we're going to, and when we say redirect, we mean like bring things back towards whatever we think the issue is. So, we've talked a lot about specific examples of somebody, lost their pension and that was taken away from them. And now, maybe their father has to like find ways to support himself late in life. Or, we talked about not getting the COVID vaccine, even though you have frontline exposure. There's a lot of different kind of like personal particular issues that we can try to tie back to larger issues. And so what I want to do now is share another handout, which is about how AAR works, and just go through the example that we have here. So again, this is, and I've pasted that in the chat, so if you can open that, that'd be great. So again, we're going to take as an example the question, won't universal healthcare be too expensive for our country? And so, I think a lot of people who have thought about this a lot, their first answer is no. And I'm just going to say, don't answer that way. Instead, try to find some way to show them that you're on the same page and that you have the same concerns. And so you're going to affirm by looking for something that you can agree with. So an example that is written here is, yeah, it's definitely going to cost a bunch of money to ensure that everyone in America gets the care they need. So I can understand why you'd be worried about things getting even more expensive than they already are. I already struggle to pay my bills, right? So you've kind of told them like, yes, it's legit to be worried about this. I would be worried about it too. And so they'll take you more seriously if they see that concern as meaningful. So now you can then pivot towards trying to provide an answer. One way to answer this would be to provide a personal anecdote about a time that you had to pay a whole bunch of money for healthcare, got a surprise bill. I think a lot of us have these stories. What I've written here is a kind of more factual, like based way of going at it, is to say healthcare already is really expensive in America. We pay twice as much as other wealthy countries that have programs like the Medicare for All single payer program that has been proposed. And here, like again, it's really important that if you have some personal anecdote that's relevant, it can be really good to share that. And then it's also really important to be truthful, to be concise, and to give sort of the best answer that you can. If you don't have the right information, just tell them that, that's fine. Okay, so then what you want to do after affirming their concern and answering it is to redirect it towards something that affects their life. So a pretty straightforward one in this case is something like, have you ever avoided going to the doctor because you were worried about the bill you might have to pay? Do you think you'd be more likely to get the care that you need if you knew you wouldn't get a bill? There's all kinds of questions like this that you can ask. The idea is really, how can you connect their own personal struggles to the types of issues and that we're dealing with, and also to the types of kind of propaganda that they might be exposed to. So they might be exposed to the idea that there would be long lines or something if we had some version of socialized medicine. And so you get them to think like, how many people or how often have you like just gone not even getting in a line, just gone without healthcare because that you wouldn't get it if you tried, or it would be too expensive. So in summary, you want to really do your best to show that you're listening, to identify the common ground, even if someone's saying something that you mostly don't agree with, trying to find that kernel that you can. And then most importantly, you want to just kind of redirect in a way that asks a question. This can be tough because, you know, it can be awkward to stand at someone's door and ask them a question that feels overly personal about their insurance or whatever. But I think the more we can get used to doing that, the more you just give them a chance to think about the issues in light of their own personal struggles, rather than to kind of be told by someone who thinks they know everything, like how you know, their life could get better. So in a few minutes, we're going to do a kind of like practice activity that's going to say, how do we use this AAR format when we interact with these different kinds of statements listed on this disorganizing emotions sheet. But I think that's it for my section. And now I'll turn it back to Liv.
Okay, I'm back. And I'm doing this last little portion, this little tactic before we, as Tyler just said, do some practice with AAR. And I will say AAR is like one of the most popular things that we always talk about when we run these trainings. Because I know that a lot of people on here are like, well, I just wish I knew like what to say when somebody comes at me with whatever. So think of some of those examples and you can bring them to your breakout groups and we can talk about, we can brainstorm together like what's a good AAR. But I'm going to now touch on the final tactic that you could employ in a conversation. And we call this framing the choice. And this is actually kind of a new one for the Philly DSA Canvassing Committee. This is our debut. But Vicki Fleck, who couldn't be here tonight because of work, she's staff at a union, and she said that she's been working with this kind of tactic a lot, and so she wanted to bring it to us. And I thinking back to some conversations that I've had, I wish I would have employed something like this. So I'm going to talk about, I'm going to give an example in a bit. But this is the tactic that I picture you're going to use with somebody after you've talked to them for a bit. Maybe you've like gone back and forth. Maybe you've gone in cycles. You've tried AAR on a couple different like tough questions that they've thrown at you. But ultimately, like you get the sense that they recognize the problem, or like, you know, like you already know they told you about this bad thing that's happening in their life, and or they're like mostly positive to agnostic on the actual campaign if there's an ask, but they don't want to commit to anything. They're like really wary to like ultimately take a stand. So yeah, you typically wouldn't go straight to this tactic, but this is because it can kind of come off as an ultimatum, but I don't want to say that to discourage you from using it, like even with your friends. It's not like choose a side or we won't talk anymore. But it can be useful, like when you get down to it, when you're just exhausted from talking about these issues. The way that it works is to lay out the choices that someone has regarding an issue, their issue, hopefully, which will hopefully lead them back to the conclusion that taking action, like being on the side of supporting this campaign or policy or something, is better than the alternative, which is doing nothing, or even maybe supporting like something opposite. So we always want to avoid telling someone why they should be doing something and let them come to that conclusion about why they need to act. So I'm just going to go straight to an example because I think that's the best way to present it. And I went a little long in my first portion, so we can be short in this one. So I was remembering this conversation that I had when we were doing Bernie canvassing at some point in the last year and a half-ish. We were up in Mayfair, like Northeast Philly, and had a long conversation with a couple of women who were they were related. I don't remember exactly how. They were just sitting on their stoop smoking, and we walked up and like started talking to them. They were friendly, like they were definitely willing to talk, but they were also kind of amused at us, like walking around their neighborhood. Just it seemed like random to them and unexpected, and they did not want to come around to supporting Bernie. However, they did say that, they said this multiple times, they felt that the system was rigged, and specifically they felt that their neighborhood was unsafe. And they said this a couple of times, as I remember. So this conversation went on for like probably too long, but looking back, I wish I would have used this framing the choice tactic. So an example of how I could have done that is saying something like, so yeah, I'm just thinking about how you've said you feel like you've worked really hard, but your community is being underserved, and that's really tough. Like, I agree, that's not fair. So we can keep waiting for maybe something to get better, but more likely nothing, and everything's gonna keep being neglected. Or you can take action and support a campaign led by somebody like Bernie, who is really talking to people like you guys and doesn't want you to feel unsafe and wants you to feel rewarded for working hard. So will you join us? That's the example. You always want to frame the choice by giving the bad choice first. Like, well, you could like not do anything and hope it gets better, or you can join us and like join a fight, join with other people who feel the same way, that kind of thing. I think that's pretty straightforward. As I said, it can almost seem like an ultimatum, but it doesn't have to be. Like, if you're talking to a friend, like, and you just want to end the conversation, you'd be like, well, it seems to me like you can either blah, 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 or you can support blah, blah, blah. So I have a quick little ask of the audience. Feel free to type this in the chat if you would like. So imagine that I have this conversation with the person who says his dad lost his pension. He's really like anxious about his dad having to work when he's quite a bit older. And I bring in like, there's this campaign where like we need to make sure that pensions are guaranteed, blah, 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 blah. And then it gets to the point where this guy keeps going, you know, I guess I'm just like not that political. Like so that's his line that he keeps going back to. Does anybody want to, like, you can type this in the chat in shorthand even, come up with like, what's a frame the choice phrasing that you might use on this person? So Greg says, your boss is political, your landlord is political, and they have the money to buy the politicians. That's an interesting point. I don't know how this is working into a frame the choices. Let's see. So, well, like, it sounds like to me, your dad has it really tough and you have it really tough worrying about him. So you can either just hope that by some luck he like is able to keep being supported, and in the meantime your dad's boss is political, etc., etc. Your landlord's political, like people will be buying off the politicians to take money away from you and your family, or you can join the fight to make sure that all people have dignity living into their older years. Something like that. Yeah, I like what Marlon said, politics sucks, because it's such a normal response, and it's so true. Politics does suck. Like, to know all the minor characters and like how the bills work and move through whatever legislative body, politics does suck. But when you're moving with an organized body of people, like, that's where politics matters. So thank you to everyone. I didn't get to read all the responses, but you can keep thinking about this. Sorry I don't have like a little handout, but I hope that it's pretty simple, like trying to frame the choice between not doing anything, maybe wishing, hoping, or taking action. So now I think that we're gonna move into breakout rooms to do AAR practice. Hadas.
Yeah, so I'm gonna open the breakout rooms and it should force you into those in a second. I'll be in the main room if anyone has any questions or anything. And then this wraps up at 7:30, so we'll come back together before, after the breakout rooms, just for both questions and next steps. And Leslie's gonna kind of tell us about what DSA has going on going forward. So enjoy talking to each other. If there's any immediate questions that you have, we have some time for that if you want to pop them in the chat. So I'll give a minute for that, but if not, we'll turn things over to Leslie, and I can stick around after. A few of us from the canvassing committee can probably stick around after. And again, I'm going to put my email address in if anyone wants to talk DSA stuff in general. But yeah, feel free to pop in questions if you have those. And I'm also going to put the sign-in sheet in there one more time if you haven't gotten a chance to sign in. Okay, I see a question from Larry. I don't know who it's directed at. Would you be willing to tell your story to a politician? But feel free to unmute if you want to expand on that. And here's the sign in again.
I think the idea there is that if someone has a problem and they seem prepared to make some changes, the idea is to let them know that their story has to be told before anything can happen with it.
Yeah, I think that's good advice. Thank you. Liv, did you want to share anything? I think I just shared this sign in again, but I will post that in again. But Liv, did you want to share anything from your group?
Yeah, I don't think the sign in went to the everyone chat for some reason. Well, actually, Larry was in our group. I just was impressed by some of the great redirected questions we came up with, because that's such a difficult part. And someone brought up like the fact that so many people support Medicare for all. And so if you wanted to redirect somebody who's feeling hopeless, you could say something like, why is it that so many people support Medicare for all and yet our politicians aren't listening to us, or something?
Yeah, thank you. I want to make sure to get folks out of here on time. So feel free to keep putting any questions in the chat, and we'll make sure to get back to you about them. And I'm going to turn things over to Leslie. But for my part, just thank you so much for coming. It's so nice seeing all of you here.
Awesome. Thanks, Hadas. Hey, everyone. My name's Leslie. I use she, her pronouns. I am a member of our canvassing committee and also of our labor committee. So I'm going to start by just dropping a link to a survey in the chat. If everyone could just like open that on your browser, fill it out. Hadas is also going to send that out in an email, but it's really helpful for us to get feedback on like, you know, what people learned and what they also want to see in the future for training. So any general comments and feedback is really, really appreciated. I also wanted to ask everyone to drop something that they learned today and something that they're going to take away with them when they're having organizing conversations, especially like relational organizing conversations. So I'm going to give people like 20 seconds if you could just drop that in the chat. Gonna do a better job of framing the choice. All right, nice. AAR, so that was super helpful. It doesn't have to happen all at once. It's so true, especially with relational conversations, right? Like, these are people in our lives. We're going to have lots of conversations with them. It's not the same thing as canvassing. Framing the choice is a great device. Nice. Okay, in the sake of time, I'm going to keep us moving, but like, please keep dropping them because I think it's helpful for people to read through these. So we have a lot to fight for right now. I do think it's important that we celebrate some of our chapter successes. In the last year or so, the Labor Committee has really worked on strengthening relationships with unions and working with unions like Teamster 623, for example, on legislation like the Essential Workers Bill of Rights. We organized this summer with sanitation workers to help them fight for PPE, hazard pay, and against layoffs. And those relationships are really crucial in the fight that we have ahead to fight against austerity and budget cuts and layoffs. Some of our electoral successes in the past few years, we helped send Elizabeth Fiedler to the state house. We elected Kendra Brooks to city council, and more recently, we elected Rick Krajewski and Nikhil Saval to the state legislature, which now means we have 3 Democratic socialists in the Pennsylvania state legislature, which is wonderful because now we have an opportunity to work with these people and hold our elected officials accountable, right?